This season of This Headache Journey is sponsored by gammaCore non-invasive vagus nerve stimulator, the drug-free solution for migraine and cluster headache. gammaCore is the first and only FDA-cleared non-invasive device to treat and prevent multiple types of headache pain via the vagus nerve. It's small, handheld, and portable for quick and easy treatments whenever and wherever needed. gammaCore is safe, effective, and easy to use. Learn more at gammacore.com. That's GAMMA core.com. Hi, I'm Adam Flaherty. I want to sincerely welcome you to the first episode of This Headache Journey. My hope and my goal for this podcast is that you can use it as a resource for education on many of the various modalities and interventions that are available to those of us who suffer from chronic headaches. And by recounting in detail the various things I've tried, and I've tried a lot of different things, that it might inspire your next move as you navigate your headache journey with tension headaches, cluster headaches, sinus headaches, cervicogenic headaches, or migraine. I want to be very clear about this. I am not a doctor, and nothing in this podcast should be considered medical advice. With each new intervention I explore, I try my best to be open-minded. I want to give it a chance to work. But that can take weeks or months of time and also a lot of money, especially when I'm trying something that's not covered by insurance. But in that spirit of open-mindedness, I also tell myself that if this one is the magical unicorn, the one that finally cracks the code of my daily headaches, and there's a chance that I could live pain-free, I'd pay just about anything. Spoiler alert, I haven't found that unicorn yet. But I do know that many of the things I've tried are very effective for other people with chronic headaches. So, if my years of expensive, time-consuming trial and error can point you toward your unicorn, or even if I can just save you some money and help you realize that you don't want to try radiofrequency lesioning where they inject a needle into your occipital nerve and send pulses of electricity through the nerves in your scalp, creating a pulsing sensation in your temples, well, I consider that a win too. So here's what you can expect from the show. Each episode will focus on a different intervention. I'll give you an honest recount of my experience with it, and I'll interview an expert on that specific modality, medication, technology, or practice. By the end of the episode, you'll have a solid baseline knowledge of that intervention, and probably a good idea of whether it's something you'd like to try or not. I'm assuming if you've had chronic headaches for a long time, you've likely tried a lot of different things to reduce the frequency and intensity of your headaches too. And I welcome you to share with me what you've tried. You can email me directly at adam@moderndadhood.com. If you've tried something I haven't, maybe you'd even be willing to join me for an episode to dig into it. Before I get into today's topic, chiropractic care for chronic headaches, I'm going to do that very podcasty thing of asking you to please subscribe to This Headache Journey on Apple Podcasts, Spotify, Amazon Music, or wherever you listen to your podcasts. And if you find this episode useful, it would mean the world to me if you left a short review on Apple Podcasts so that others can learn about the show too. And with that setup behind us, I bring to you the first episode of This Headache Journey. I've had chronic daily headaches for as long as I can remember. Literally. I haven't had any traumatic injuries. My mother said that my birth was not traumatic, and aside from telling me to avoid caffeinated soda, which I rarely drink, or coffee, which I will never give up, my primary care physicians over the years have never treated it like it was a big deal. But around the time I got married in 2010, I was 27 then, and you can do the math, I decided that I was done just living with it. There had to be a doctor who could figure out the root cause. My PCP supported my exploration and ordered up an ultrasound of my brain to rule out any abnormalities. The results were clear, and that was a relief. A number of years later, I had another MRI of my brain, this time using the dye that they put through your veins, and that imaging showed nothing of concern either. But that first ultrasound officially kicked off my journey of sampling medications, being cracked and crunched, stretched, sinus flushed, brainwave monitored, and poked with way too many needles. One of the first stops was the office of a chiropractor I knew. We were in a business networking group together, and I don't recall exactly who initiated the conversation, but I ended up in her office for a consultation. She did some basic adjustments, and if you've never been adjusted by a chiropractor, I'll describe it for you soon. But she told me ultimately that one of my legs was slightly shorter than the other, so I should wear a lift in one of my shoes to balance myself out. I don't think I wore it for more than a day. This was probably 12 years ago, and I've since been to 4 other chiropractic practices. That didn't seem like a lot until I just said it out loud. They've all been similar enough. It starts with a consultation, some x-rays that for me always showed that my head is too far forward and my atlas bone is out of alignment. More on that later. But yes, those 2 things could be significant factors in my chronic daily headaches. Now, I don't know about you, but when a licensed practitioner tells me that they can clearly see something wrong with me and they're confident that they can help, my instinct is to give it a good, fair try. Again, what if they are the unicorn? Ultimately, as evidenced by my bouncing around to different practices over the course of those 12 years, chiropractic has not, to date, been that unicorn. But I've also come to realize that the magic unicorn probably doesn't exist because, at least in my case, it doesn't seem like there's one root cause of my headaches. There are different underlying issues such as stress level, barometric pressure, quality of sleep, muscle tension, and structural alignment, probably among other things too. Sometimes it seems like there's little rhyme or reason for why I wake up with a severe headache which stays with me all day long, or why I go to sleep with intense pain and wake up with only mild pain. I've tracked some of this data and it just never seems to correlate. But I'm currently seeing a chiropractor, and though I know he's not fully satisfied with the results so far, I remain hopeful that consistent adjustments with him will lead to long-term positive physical changes. And if that corrects even one of the contributing factors to the frequency and the severity of my headaches, that's a positive thing. My chiropractor's name is Brett Racine, and his practice is called Bonfire Chiropractic and Wellness in Portsmouth, New Hampshire. To be fully transparent, I contacted Dr. Brett because of an ad he was running on Facebook that intrigued me, and his office is walking distance from my office, which is a huge selling point because I can easily squeeze in a couple of adjustments a week during lunch without it being a heavy or intrusive time commitment. Now, Dr. Brett will explain how chiropractic care can benefit people like us with chronic headaches way better than I can explain it. And after the conversation, you'll get to hear about what a chiropractic adjustment typically feels like. With that, I'm excited to share my recent conversation with Dr. Brett Racine, which was recorded right at his practice, Bonfire Chiropractic and Wellness.
My name is Brett Racine. I'm a chiropractor here in Portsmouth, New Hampshire. My practice is called Bonfire Chiropractic and Wellness, and we've been here in this spot on Deer Street for about 3 years now.
So for someone who knows little or maybe nothing about chiropractic, can you give me sort of the elevator pitch about what chiropractic care is?
Sure thing. How long is this elevator ride? So at a really basic level, I like to think about chiropractic care as not so much just a short-term treatment modality for neck pain, back pain, which is what people really have us kind of pigeonholed for, and frankly, rightfully so. I like to think about it much more as a lifestyle success strategy for a healthy human being. So my elevator conversation would sound something like this. It's modern life is unnaturally stressful. Think about it. It's stressful for you physically. It's stressful mentally. It's stressful chemically, and it's stressful emotionally. Mm-hmm. As a modern human, you have more stress in one day than some of our more primitive ancestors may have had in a week or a month or maybe even 6 months. Right. And so the fact is that all of that stress coming at us all of the time has a degenerative effect, not just on the function of our brain and on our nervous system, but it can have a detrimental effect on our bodies too. Think about how much time, for instance, right, how much time people are spending staring down at their phones. What is that doing to the healthy, normal curve that their spine is supposed to have? We see it degenerating over time. And what's frightening is that we see it in younger and younger kids. So I view chiropractic care really as a simple and elegant solution to help bodies and minds better adapt to the stressors of their modern life.
So do you recommend chiropractic care for everybody, as opposed to somebody who's just experiencing some kind of acute pain in their body and wants to treat that. Is this something that everybody should be doing?
That's a great question. And the answer is only people with a brain and a spine and a spinal cord.
Okay. Right. All right. That's most people that I know.
Yeah. Well, look, everybody benefits from being stronger and healthier, right? Yes or yes. And that's really, at the end of the day, what we're trying to do is cultivate greater strength, greater resilience for people so that they have the energy and vitality they need to live a big, awesome, fulfilling life that they want. So for that reason, yeah, I recommend chiropractic care for everyone. It's a primary healthcare strategy for myself. It's a primary healthcare strategy for my entire family.
What would you say are the most common misconceptions about chiropractic that you hear from new patients or people who are consulting with you?
Yeah. Again, how much time do you have? It's like the misconceptions are aplenty. I think very often we get stuck in this very limited domain of helping people with neck pain and back pain. And can we help with those things? Absolutely. But the fact is that our ability to help people extends far beyond that. The simple fact is that we're all designed to be healthy. We're designed to be healthy and strong for a lifetime. But because of the cumulative load of all that stress in our life, a lot of people are suffering unnecessarily. So we can help people to better adapt to the stressors of their life so that they can start to heal, so that they can ultimately get back to life. And so the misconceptions, to more directly answer your question, are that we can only help with neck pain, back pain. Two is that chiropractic doesn't work. I hear that, that misconception all the time. And the simple fact is, yeah, it might not work for everyone. However, that doesn't mean that as a practice, it doesn't work. And I would go toe to toe for an hour with anybody who wanted to push back on that.
So before we get into talking about headaches specifically, again, sort of in the most compact way possible, how do you differentiate your practice from another chiropractic practice?
Yeah, that's a interesting question. And you can speak to this, right? Because you're a client here at Bonfire, and thank you for your trust. I wouldn't say that we have specifically a symptom-based practice here. So in other words, I don't go out and advertise and tell people that, I can help with X, Y, and Z symptom. Mm-hmm. Really, what we try to do at the end of the day here at Bonfire, and I think this is probably what differentiates us, is we have a brain-based approach to our chiropractic care, which makes the adjustments that people receive here very gentle, very specific. And as a result, people find the adjustments here to be very tolerable. We also have a massive emphasis on education here in the practice. The mission of this practice is to educate, adjust, and support people who want the health they need to live a life that they love. And what I love about practice is taking the education portion of that mission so seriously. So we run live workshops here. I'm in the midst of producing a digital video academy that helps people to break bad habits that get them in trouble and then adopt healthy new habits so that they can start to cultivate better health over time versus breaking down over time. So what sets us apart, I would say, is our focus on education. Yeah. And we do that specifically within 4 domains: nutrition, movement, mindset, and sleep.
Thanks for that. So for listeners who have been struggling with chronic headaches for maybe years and haven't explored chiropractic, can you speak to maybe how you have seen chiropractic care help people with that type of chronic pain?
Look, headache, you know this better than most people. Headache can come from a variety of sources, right? Yep. They can be vascular, they can be neurological, they could be cervicogenic, meaning coming from the neck. Really, where I can help people is in the case of cervicogenic headache. You probably know this already, Adam, but your brain is not attuned to pain. So your actual brain itself does not have nociceptors, which are pain receptors. However, your brain is covered with this substance called the meninges, or the dura mater, which means tough mother. So that is pain sensitive, right? And so the simple fact is that dysfunction coming from the upper cervical region, so C1, C2, and even C3 in a person's neck, dysfunction in that area of the neck can often present as pain in the head. It can present as headache. So for anybody who's really struggling with headache, if they have not had their upper cervical region examined, that could potentially be really low-hanging fruit. Now, does it help for everybody? Absolutely not. I wish that it would, but the simple fact is that in the domain of our health, there's never this magic bullet, if you will, that's going to ameliorate or solve all problems. And certainly, unfortunately, chiropractic is not one of those magic bullets, right? Because they don't exist.
Do you recall when I first came in, we did a consultation, you examined my posture, you took x-rays. Can you remember what you saw with those and how that aligns with someone who, maybe a typical sort of headache patient?
Yeah, sure thing. So I remember it very clearly. And one of the biggest findings for you was when we did your posture analysis, we noted that you had well over an inch of anterior head translation, meaning that your head is being carried much farther forward than your proper center of gravity. And so what happens there is that can inappropriately load the musculature in your posterior chain. So you have these huge muscles, right, that originate on the occiput and the base of your skull, your trapezius muscles. Mm-hmm. Those are visible, right? And they're huge and on you, they're very strong.
This is an audio format only, but I do want everybody to know that my muscles are literally bursting out of my clothing. Yeah, I'm a monster.
It's really distracting. So it's obvious, right? You can obviously see that those muscles are working harder than they need to. But what's more important are those deep, they're called the intrinsic muscles of your spine. And for years and years, anatomists thought that those tiny little muscles that surround the entire spine, particularly your upper cervical spine, it used to be thought that those muscles were responsible for fine motor control. And to a certain degree, they are, but it turns out that they're much more neurologically rich than initially thought. And so those muscles are constantly firing information up the spinal cord to a very particular part of your brain. They're firing information about stretch and load. And that gives your brain an instantaneous sense of where you are in space at any given moment. That sense is called proprioception. So those muscles in the neck are very proprioceptively rich. Now, if the spine has been distorted for a long period of time, what do you think that's doing to the information that's traveling up the spinal cord to your brain?
Mm-hmm. Yeah, I mean, it's totally garbling that information.
That's right. Yeah, it's inaccurate information. And you know this from running business. It's like if you're getting inappropriate reporting, you can't make accurate decisions.
Right.
And the product that you're going to ultimately produce is going to be compromised. And your brain and your spinal cord are the same way. If it's bad information traveling up the spinal cord to the brain can't make an accurate decision. It can't issue an accurate response. And if that's happening, day after day, week after week, month after month, is it any real surprise then that over time, some dysfunction is going to result? Some symptoms might start to creep up. And over time, breakdown is going to occur.
And in my imaging, you confirmed what I had learned years prior, that my atlas bone, which is the C1,
that's exactly right,
has been way out of whack for a long time. So you can speak more to this, but the axis was off and the tilt was off. And so the adjustments that you've been doing to me, for the most part, have been trying to correct for that, right?
That's right. Yeah, trying to correct the subluxation or the improper location of that atlas bone. And the reason, like I said before, the reason that that's important and that that's relevant to your headaches is that improper function and how your skull articulates with the top of your spine, which is at your C1 and your occiput junction, that can easily and commonly result in what we call cervicogenic headache, meaning headache that is coming from dysfunction in your neck.
Can you describe what maybe one of the most common adjustments looks like when you're dealing with cervicogenic headaches and people who have issues in their C1, C2, C3?
Mm-hmm. Yeah. So to the best of my ability, the adjustments that we do here in the practice, I try to do very low force. So you can attest to that. Often I'm adjusting with an instrument, which is very, very gentle. Frequently though, people need more. And in your case, I'm adjusting your C1, I'm adjusting it by hand. Right. So that involves me cradling your head in one hand, finding the left lateral mass of your C1 and setting it by hand. And you can speak to what that experience is like from your end. What does that feel like to you?
I would say for me, a chiropractic adjustment I guess, kind of hard to put into words. In some ways, I think about the psychology of it. You're laying there and really you're very vulnerable and putting a lot of trust in the person who is doing this adjustment. This is something that maybe listeners who haven't experienced chiropractic might be very hesitant about or nervous about. It might be a reason that they haven't explored it in the past, because when somebody is literally holding your head in their hands and making an adjustment that, sometimes can create an audible noise, the idea of it can be very disconcerting or maybe off-putting. I would say in my experience, I've tried so many things that letting somebody manipulate my head and my neck, as long as I trust that they're an experienced practitioner, is not a hard decision for me. I'll do it, because if it works, that's great.
Well, I do appreciate that trust. And my experience of you is that you're a very trusting person.
Maybe to a fault.
You asked at the top of the show, what are some of the misconceptions that people have? And that just triggered my memory, is that a lot of people are afraid of being adjusted because they are concerned that it could injure them. Mm-hmm. And that is, I can understand where that comes from. We've all seen movies, right, of people having their necks twisted and having their necks broken, et cetera. And the adjustment is just nothing like that. It should not, as you said, if you're with someone that you trust, who is qualified, it should not be a scary experience. Sometimes the adjustment can be a little bit uncomfortable. Sometimes it is a little bit painful. That hasn't been your experience, thankfully. But I can tell you, I'm a raving recipient of chiropractic care, mm-hmm. and I've received plenty of adjustments that have been uncomfortable. That discomfort is temporary, right? It subsides, but the benefits far outweigh any sort of temporary discomfort.
Now, each patient has their own course of care that you create individually based on what you believe they need. For me, I've been coming in 2 to 3 times a week for several months now. But for somebody who, again, knows very little about chiropractic, has not experienced it before, how long would you typically say that someone who comes in with a symptom like headaches would be seeing you? Is this for months? Is this for years? Is this indefinitely? Because I know that the time commitment and cost can be prohibitive for people. It has to fit. For me, if I'm going to try something new, it has to fit in with my life and my schedule, and it has to be something that I can afford. And if I know that in order to prove this out, to really give this a chance to see if it's going to work, that it's going to take 2 years, 2 to 3 times a week, like that's a huge commitment. So can you give any sort of ballpark, which I'm sure is hard to do because each patient plan is totally unique and individual. Can you give any sort of guidelines as to how long somebody might expect to be working with you when they come to see you for something like headaches?
So the short answer is that everybody is different. You understand that. That said, the recommendations that I make are always based on 2 simple things. One is the goals. What are your goals as someone coming into the practice looking for help? And then the second thing are, what are my findings, right? So those objective findings paired with your goals tell me what I think you need to do in order to get what you want. That said, everyone who comes into the practice starts with an initial intensive care plan of 4 months. I really find that 4 months is a sweet spot where almost everybody experiences some benefit and nobody gets impatient.
And then I'm sure that people are hesitant about the billing part of this because a lot of chiropractic practices, yours included, you don't work with insurance. And I'm sure there's a number of reasons for that, but the financial commitment can be something that's a challenge for people. How do you sort of work around that? Or do you find that for you, you're as busy as you want to be and it's not a problem that you have to address?
Mm-hmm. Yeah, it's a good question. We all have the same limited resources. We have varying degrees of them, right? But those limited resources are time, energy, money, and focus. We all have the same limited resources. That said, I rarely find that the money is the big factor for people. For some people, money is really tight and that's a limiting factor for them. For most people, it's the time and it's the energy and it's the focus. They don't want to make that commitment. And I understand that and I see it all the time. But the simple fact is that healing takes time. There's no process in nature that does not take time. And for most people, if they develop some sort of symptom, that symptom was most likely years, or months, or at a very minimum, weeks in the making, right? It's very rare, absent some acute injury, that there's some process, some disease process in the body that didn't evolve over time. So why would healing be any different, right? Of course, it takes time to heal. But that said, we live in this culture where everyone craves instant gratification. And I don't blame anybody for that. Our brains are hardwired, right, to crave instant gratification. But healing doesn't work that way, right? And so the time, the energy, the money, focus, commitment, people have to make all four of those commitments in order to get care here. It's almost never the money that prevents people from coming in.
In terms of the frequency that someone might come in, I know for me, like I said, I'm at two times a week. I know that sometimes at the beginning it's more frequent and then it goes down to, but the idea behind that is that you're making a specific adjustment and the next time I come in, you are seeing if that adjustment has held, right? And if it has held, then that's great. And if you see that trend, that the adjustment is holding, then you might space out appointments with more distance in between them. Whereas if you see consistently that the adjustment is not holding, you may recommend more appointments. That's
exactly right.
Okay.
Yeah, that's exactly right. So it's how long you're holding your adjustments that determines how frequently you'll be adjusted. The idea is to get people as quickly as possible to a point where they're being adjusted once a week or less.
I think my last question before we go and do an adjustment would be, for somebody who is not in Portsmouth, New Hampshire, like I am right now sitting with you, and they want to explore chiropractic care, what are some things that you would recommend that they're looking specifically for as they're maybe comparing one practice to another?
Do your homework. And there's a number of ways to do that. People have reviews, right? So it's one thing for you to listen to what I'm saying about our practice. It's another thing for you to read and see what our clients are saying about our practice. So we live in this review culture, right, where it's easy to get social proof. I would suggest that people use that resource. If you've got a chiropractic office that has no reviews, but they say awesome things about themselves, and then you have another chiropractic office that's not great at self-promotion, but they have 50 reviews that are all 5-star, go with the one that has the reviews. Go with the one that has social proof. Second to that, I would say delve into their web presence. What are the core values of that practice? What is the mission statement? What is that practice? What do they profess to be important to them? And you've got to work with a practitioner that has goals that are aligned with your goals, right? Because if you're coming in looking for one thing and I'm delivering another, that relationship is not going to be successful.
Aside from negative reviews or a lack of reviews, are there any other red flags that you would suggest that people watch out for before they engage with a particular chiropractor or practice?
Here's a good general rule of thumb. Most of us have this real visceral knowledge about, when you meet somebody on the street, you have an instantaneous visceral reaction to them, right? Or you have a voice that tells you something about that person. When has that voice ever been wrong?
That's a great point. Yeah.
Almost never, right? It almost never lets you down. The problem is that we get distracted or we don't listen to it or we don't trust it. Or we've been taught not to listen to that innate wisdom within us. And I would push back on that. And I would say trust that. If you meet a chiropractor that you just instantaneously have rapport with them and you feel safe, you feel like you're in the presence of someone who has your best interest in mind, go with that.
Do you have any particular stories in your several years practicing of someone who has come in with chronic headaches, who you've helped to lower the severity, lower the frequency?
Yeah, I have a couple. And look, I really, really want for you to be one of those stories. But I think we're behind where I hoped that we would be. And you unfortunately have not had that, kind of miraculous, for lack of a better term, amelioration of your headaches. But I've had a couple of those cases where people have come in with chronic migraine that will take them out for 24 hours, 36 hours at a time, and they just have to be shut down in a dark room and shot X-rays, and there was glaring indication of subluxation of their C1, their C2, or C3 vertebra, and within a few adjustments, those migraines cleared up, and people were back to living their life. And what's kind of unfortunate about those cases is that someone comes in with an acute issue like that, it gets better, and then they forget all about it. Mm-hmm. And then they discontinue care. And then what do you think happens?
I think that their adjustment slips and they probably go right back into their migraines. Yeah.
Eventually they come back. And I think that that's really the problem with this kind of symptom-based approach, is that human beings are hardwired to move away from pain, to move towards pleasure, and to do those things with the greatest economy of energy. It's like we're hardwired to be cheap and lazy. We don't want to do things that are hard and expensive over and over and over. Mm-hmm. And chiropractic it's expensive, and it takes your time and your energy and your focus, right? So it's hard and it's expensive. So for so many people, the minute they start feeling better, they're out the door and they don't come back, but their symptoms do come back, right? And so the reason that I think chiropractic care is so effective for people, and I think it should be part of, not the only part, but it should be like a bedrock part of their wellness care, is because those symptoms are just going to come back, right? So it's like, you don't stop brushing your teeth just because you haven't had a cavity for a while. You don't stop flossing because you haven't had a cavity for a while, right? You don't stop working out just because you feel strong and you look good in the mirror. Mm-hmm. You keep doing that thing. It's a lifestyle success strategy for a healthy human being. And that's how I think that chiropractic care should be as well.
Where can people learn more about Bonfire, learn more about your practice and your philosophy towards chiropractic?
Well, if you're lucky enough to be listening on the Seacoast area in New Hampshire or Southern Maine, you can just pop into the office. We're at 33 Deer Street in downtown Portsmouth. You can check us out on the web. It's bonfirechiro.com. And very shortly, we're going to be unrolling this digital academy that I've been building over the last few years, which is it's really a digital tool that you can use to start to clean up your habits and behaviors in 4 specific domains of your health. And those domains are your nutrition, your movement, your mindset, and your sleep. The simple fact is that your health needs to be cultivated. And if you're going to cultivate it efficiently, tackling those 4 pillars and getting your habits and behaviors in check within those 4 pillars, nutrition, movement, mindset, and sleep, is a really, really great way to start. And so you can check us out there as well at the Bonfire Wellness Academy.
Dr. Brett, thank you so much. I appreciate you so much. And what do you say we go do an adjustment so people can hear what that sounds like?
Let's do it. Okay, you can head face down on the table.
Dr. Brett will either have me start face up or face down on his table. He checks the alignment of my full spine through a series of motions, including bending my legs and asking me to turn my head to one side or another.
So first thing I do here is get you face down on the table, and I just gently palpate your spine. So I'm just feeling what comes up at first glance or at first touch. Then I go down to the feet here, and when I pump your feet like this is really a functional reflex. So what I'm looking at is how quickly do your feet rebound, and what's the relative degree of rebound from one side to the other. And believe it or not, how that reflex presents gives me information on where in your spinal cord there might be some torquing or some rotational component that should not be there. So when I have you turn your head like that from one side to the other, it helps me rule in or rule out the presence of some torquing or some rotational component in your neck that should not be there.
He'll usually use a small handheld device called an activator, which is kind of in the shape of a large syringe. He presses one end against a misaligned bone in my spine or my neck, and when he squeezes it,
let's have you take a deep breath in. Good, and blow it out.
It kind of thumps on the bone, causing it to shift slightly back into place. The activator does not hurt. Sometimes he'll do adjustments with his hands by pushing down on my spine forcefully, which can result in a bit of a popping sound, and this has also never been painful to me. When Dr. Brett adjusts my atlas bone, which is my C1 vertebra right at the base of my skull, I'm usually face up.
So here with you lying on your back, I'm going to gently adjust your C1 vertebra, otherwise known as your atlas. So my right hand here, I'm cradling your head.
He cradles my head in his hands from behind me and then moves one hand down to the side of my neck behind my ear. He rocks my head a little, presumably to ensure that I'm not holding on to any tension in my neck, and in a swift motion, he adjusts the angle of my head with one hand and manually pushes my atlas bone with the other one.
And very, very minimal movement of that vertebra.
It's a fast, kind of jerky motion, but it also does not hurt me, and I never get the sensation that anything has been, overextended. Sometimes there's a slight crunching internal sound, but not always, and even if that sounds gross to hear, there's nothing that's off-putting about it to me in the moment. Well, thank you very much.
You're welcome. Yeah.
So in summary, chiropractic care for me is not the be-all end-all that makes my headaches disappear, but in studying my headache log, things seem to be a bit more regular and predictable since seeing Dr. Brett, which is a good thing for me. I tend to ping-pong back and forth a bit more, which means more regular low-pain days, and even that is a win. Dr. Brett and I like to joke that I'm consistently inconsistent. But I believe in Dr. Brett, I like his approach to his practice, and I'll continue to see him. So what do you think? If you haven't tried chiropractic care as a treatment for your chronic headaches, does this make you want to explore it? Please let me know by leaving a review of this headache journey on Apple Podcasts. In the next episode, we'll be exploring and I'll be recounting my experience with biofeedback. Be sure to subscribe so you'll be alerted as soon as episode 2 drops. Thanks to Dr. Brett Racine of Bonfire Chiropractic for sharing his expertise with us. And thanks to the team at GammaCore, non-invasive vagus nerve stimulator, for sponsoring this first season. My name's Adam Flaherty, and thank you again for joining me on this headache journey.